Good morning. Thank you for joining us today for this seminar entitled Building Mobile EHR Solutions. Before we begin, please allow me to introduce myself. My name is James Stout, and I will be leading today's seminar. I'm responsible for Endeavour's Enterprise Mobile Health Division. We deliver services to a range of healthcare organizations, health plans, home health organizations, and other mHealth companies. We build both mobile health apps as well as integrate those to the back-end applications within an enterprise. And I've been fortunate to be involved in several traditional EHR implementations with solution vendors like Epic and Cerner and others, and am now excited to be involved in mobile solutions in this same space. I'm supported by a team of over 200 mobility experts working in the mobile health space or the mobile technology space since 2002. Let's start with a quick outline of the sort of purpose of the discussion and the agenda. So the purpose of today's seminar is to give an overview of some of the key considerations that one must consider when contemplating building a mobile EHR. In this particular case, our focus will be on commercial EHR vendors that seek to sort of build a mobile solution that works in conjunction with their core product. However, the discussion also applies to organizations that might be building an independent mobile solution that works in conjunction with other clinical systems. We have a group of individuals on the call that are working both in sort of the software industry as well as consulting, so there's a wealth of direct knowledge of health IT. The level of detail for the discussion is intended for a mixed audience of both management and technical personnel. And in the event that you need more detailed information after the webinar, feel free to contact us directly. So let's talk through the agenda. Overall, today's seminar is divided into 4 parts. First, we'll have a brief discussion and overview of the current trends at work in this space. And we'll talk briefly about how organizations are sort of phasing EHR functionality to mobile platforms. Next, we'll dig into key considerations with regard to a development strategy, building the right sort of team to build these mobile solutions, talk about some of the UX and UI considerations that are important to be aware of, some of the security challenges and best practices, and then we'll follow up with a brief discussion on a few case studies and a Q&A at the end of the discussion. Feel free to use your chat window to ask questions. This is a live sort of broadcast, if you will. I'll try to answer the questions along the way. If I don't get to them, we'll certainly follow up with each of the attendees with a written reply after the seminar. Very good. Let's begin with a brief discussion on trends within the mobile EHR space. If one were to do a market scan of the leading EHR vendors to determine which ones are developing mobile solutions, I think you would find that the majority of the sort of major vendors, the usual suspects in this space, are all sort of building mobile solutions in one form or another. As you see here listed, Epic, Allscripts, both sort of the inpatient acute area as well as the ambulatory. Got Greenway that's developed solutions for the small physician practice as well as GE and Cerner. So a broad set of vendors that are building solutions in this space. Not surprisingly, the solutions are generally on iOS and Android platforms. Some others, but generally those are the predominant sort of applications. Most are available for free on the app stores with pricing that's sort of built into the underlying core product that comes with the license and subscription of the EHR software. And although these market leaders have moved forward with solutions, based on our research, about 40% of the 400 plus EHR vendors or clinical system vendors are still pending a release of a commercial mobile solution. So it's very much a work in progress for the industry. Many of the mobile solutions are highly visible as part of the marketing campaigns for these vendors. And so there's a definite push in visibility and demand from providers and physicians to use these tools. Many of the solutions have been developed internally by these vendors, as well as in alliance with other mobile specialists, the likes of, say, Apple, that partnered with Epic, and other sort of third-party players that have been involved in developing these solutions. And we'll talk a bit later about how certain solutions can be integrated within these or embedded within these solutions that further drive some of the innovation within mobile EHRs. Just a quick discussion around the technical approaches that are being used. There's generally sort of 4 approaches that vendors are taking. The first being developing a native application using the SDK that's provided by a particular solution, a proprietary solution, to take advantage of the qualities of a mobile device or a tablet. Secondly, web-based solutions are in development, and they utilize a web browser. Thirdly, apps that utilize both worlds, both native and web. And then lastly, some providers as well as solution vendors are promoting the use of thin client utilities like Citrix to access EHRs. The fourth option has gotten some recent press by the advisory board, who issued a report that said that the fourth approach, using sort of the thin client utilities, exposed the user to certain patient safety risks associated with using virtual keyboards and other desktop virtualization technology. So if you're interested, you might take a look at that report and see some of the challenges associated with that virtualization model that certain vendors are moving towards. Now let's take a look at just a couple examples that are at play in the market, to give you a flavor of how the solutions are being developed. The first being Allscripts, that's developed a mobile solution, actually a series of mobile solutions that includes an array of functions, allows the user to see a patient summary, appointments that are in place, results, a timeline to sort of juxtapose the individual episodes with a timeline for the patient, as well as attached documents and images with that solution. So that's recently been released and gotten some good press. And another solution on the market that is getting attention in part due to its business model is Practice Fusion. It also has similar function, patient record scheduling, facilitates e-prescribing. And lastly, a mobile solution that, as I mentioned earlier, Epic has developed with Apple. It's called Haiku and Canto. It's on the iPad. And like the others, it has an array of functions around patient lists, scheduling, visually displaying the results, and in fact has a voice dictation component. So an array of solutions on the market available in the App Store. GE is also has solutions and other vendors. For the most part, these solutions are being developed because there's recognition that they provide benefits above and beyond the sort of standard solutions that are in place that allow access via the desktop. And the benefits are namely that it provides convenient out-of-office access to the data, key patient information that allows clinicians and physicians to take steps outside of the office where they normally would have to wait until they arrive to the office. The mobile solutions facilitate faster communication amongst care teams. I think there's recognition, more increasingly recognition, that the need to facilitate communication amongst the teams, that medicine is a team sport instead of a solo endeavor, is being highlighted by the use of these technologies. Additionally, mobile prescribing is highly valued. The ability to do documentation at the point of care is improving the quality of the documentation. Productivity associated with being able to do these things, again, away from the office, and in certain instances, improved data and charge capture associated with the work in EHRs. Now, apart from these benefits, there are some interesting trends that I thought it would be good for us to discuss, because they're largely shaping some of the future of the way in which these mobile EHRs are being developed. So let's talk through these, and then we'll talk about how one's development strategy presents opportunities to innovate in this space. So to begin, as I mentioned earlier, the use of the iPad within the healthcare enterprise continues and continues to be very appealing to the physician community. So physicians are using the iPad and iPhone for applications that are specific to their specialty area. They may be reviewing reference material, and so there's just a general comfort with using mobile devices for medical information. In addition, vendors continue to build iterations of their applications, many of which are in native form. So, as I mentioned earlier, Allscripts has done a recent release of a native application, and there's continued recognition that there's value to be gained and delivered to customers by exploiting the unique nature of native applications. Additionally, in the last couple years, probably most recently this year, vendors are embedding speech recognition and natural language processing software within the EHRs to help with the data capture and dictation associated with EHRs. This is a significant change and a game changer in many ways for these solutions, because of the challenges with adoption of EHRs and the ability to do these sorts of things and to convert voice to text is highly appealing to many users of EHRs. In addition, large healthcare organizations, IDNs and others, are giving mobile access to the EHR to their patients. Kaiser being one very noteworthy example given its scale, but others are doing that as well. And that is driving or creating a bridge between what are often sort of defined as sort of siloed EHR applications and connecting them to patients that are either collecting data or monitoring their health in some fashion. And these this mobile access that patients have allow them to see ongoing notes in the EHR from physicians, a whole range of physicians across the care that they've received. Now, in addition to that integration, there has been integration of specialized patient-facing apps. Several interesting examples are Airstrip, that has done interesting work with connecting on a real-time basis patient monitoring data, and similarly the WellDoc solution that allows the disease management application that WellDoc provides to connect to an EHR, to connect end-to-end from the patient to the physician of the tools associated with their care. So those are exciting developments, bringing the sort of patient into the equation. In addition, other changes innovations that are noteworthy in this space are the open approach that some vendors are taking to their APIs, Practice Fusion being one of them, that they believe will further stimulate independent developers and innovative solutions that connect patients to these solutions. And in many ways, they're using this as a differentiator in selling their solutions. So that's noteworthy and further drives the need to be building innovative solutions in this space. Furthermore, non-traditional vendors are building what I've sort of labeled as a smart mobile layer that sort of lays on top of a EHR and can be used given the fact that you have the opportunity to improve the user experience using a mobile device. So some non-traditional vendors that have not necessarily been in the EHR space have developed solutions, SAP being one of them, and others. So that's that bodes well for the future in terms of innovation being driven by mobile. And then lastly, with the introduction of meaningful use stage 2, mobile technologies are being used in support of that to achieve the goals that are defined within those guidelines, whether it's around patient or point of care, data capture, coordination of care, or other goals within that. So a lot of very exciting activities that are driving innovation within this space. So the point being that it's not merely the move of a standard desktop solution to a mobile platform as is, that there's the opportunity to drive additional changes and improve the user experience with the mobile tools. In fact, there have been studies recently published, one by Spyglass, that said that in order to get further adoption of these mobile tools within the EHR space will require these sorts of innovations to drive further adoption. It's something to keep in mind as organizations build their solutions. So now let's talk a little bit about how the solutions and the functions within them are sort of phasing to a mobile platform. Now, if you were to look at the whole array of functions available within an EHR, it's quite a staggering number. Those systems are quite sophisticated and quite detailed and quite complex. But generally, EHR organizations, software vendors are breaking down the functionality and isolating the functions that are required for out-of-office work, and then defining which functions are required for key out-of-office use cases, such as e-prescribing and other things. And so what that does is it breaks down into sort of three categories, if you will. The first being sort of the must-have basic features related to patient lists and results. The second related to key use cases, e-prescribing and other sorts of access to documents and so forth. And then the last being those differentiators and innovations around dictation and unique ways of visually displaying information on a mobile device is sort of in contrast to what would be on a desktop. Now, since the approach to this can be varied based on vendor, typically what we see is that the vendors that formulate a strong development strategy overall from beginning to end up building a solution that is highly organized and it ends up shrinking their overall development time for a mobile solution. And for the most part, these solutions need to be developed rapidly to hit the market sooner rather than later. So formulating a development strategy consists of primarily three major activities. The first being developing the overall development approach and determining how you want to sort of phase the build and development of the mobile EHR, deciding if it's driven by the platform itself or whether there's a particular functional emphasis, and how that will sort of sequence as you release the product, somewhat like the release of functions within the underlying EHR. Secondly, it's determining how the whole design and iterative approach will occur, and how prototypes will be built, and how you will get a good feedback from the user community on the solutions that are developed. Very important to kind of do that and create a process that facilitates that. And then lastly, building and creating a life cycle for the overall product with the recognition that just like the underlying software, these applications go through a series of releases and evolutions. So one needs to build a life cycle that supports that. Lots of user feedback should be anticipated. So the structure of the development project needs to anticipate that. The next key set of activities is all around building a technology plan that sorts through questions and issues with regard to devices, the actual infrastructure, the platforms, how one will establish a development framework that allows for reuse, building the underlying sort of security framework, access controls, storage mechanisms, and so forth. So the underlying technology architecture and plan, very important to have that established. And then following that, establishing, as we discussed earlier, a functional approach in which the organization determines how these functions will migrate from the core application to a mobile application, defining what are must-have features, getting the early stakeholder validation and confirmation of the usefulness of the tool in certain scenarios, and then confirming that all regulatory and privacy and other aspects are supported. Now, in addition to establishing these plans, it's critically important to building a strong team. So in our experience, the following teams or sub-teams play a vital role on these types of projects. And this is, again, not unlike standard software development projects that are underway for non-mobile solutions. There generally is a group that does product development, that worries the issues around the roadmap and how the system will be used by clinicians, establishes a vision and a strategy in terms of the product and how it will work with the overall solution and product suite, a group that defines how pricing will be handled and how the opportunities that present themselves with an application store, getting feedback and facilitating engagement with customers using that channel, and in general sort of establishes both the product and the business vision. That coupled with teams that support engineering and define the core architecture and mobile architecture and the technical aspects, the development team itself that builds the product, does the detailed programming and technical development, and adheres to the roadmap and the technical blueprint that's been established, and then a team that works the implementation and the deployment. Very important to have individuals that understand the support and maintenance required to consistently manage the mobile application and support it as individuals use the application on an ongoing basis. Now, to build those teams typically requires these types of resources, a whole array of both clinical, technical, and operational staff. And in addition, individuals that are familiar with the regulatory requirements and the challenges related to maintaining privacy of the data and other sort of aspects. So a well sort of multidisciplinary team to handle various aspects of the project needs to be organized. Now, within the project team itself, the following skill sets tend to be of greater emphasis for mobile projects. So obviously there are project management personnel that oversee the efforts, but then there is the need to have solution architects that understand the mobile technology world, those that understand mobile platforms and device management, the things related to the MDN and how you could use that to manage the devices. In addition, specialists that understand how to craft a good UX on a mobile solution, and then obviously mobile developers that work solution platforms, the mobile solution platforms, and then other technical resources that round out the team. So these are an array of skill sets that have to be sort of organized for a project of this type. So now let's talk a bit about the UX process that we generally find is useful to organize in this space. Pretty standard, pretty straightforward, but lots of challenges within this area to develop a strong UX. It generally breaks down into three areas: understanding and analyzing the overall context, and that includes taking a step back, really understanding, as I mentioned earlier, the mobile scenarios, how the solution fits within the broader set of tools that are at a customer's disposal, and having discussions, focus groups, and others to really talk about how this new tool works in conjunction with the other product and software. Secondly, we generally organize a design stage where we have direct conversations with physicians and talk about the out-of-office mobile scenarios and how the information will be used, how the clinician will move from place to place, from setting to setting, and utilize various different mobile tools in that process, whether it's use of the iPhone or a tablet or other technologies, laptop included in that array of mobile work. And then lastly, we conduct a usability test to make sure that what has been designed visually is easy to use, easy to find information, again recognizing that the physician is in motion and on the go when these solutions are in use. So building the solutions to make it easier to operate them when there are sort of ergonomic challenges associated with using mobile tools. So in our experience working with various solutions, we found there's a couple lessons learned that I wanted to mention here as a sample of some of the challenges and things that one would be aware of when building these solutions. The first being the mobile context is critically important to understand. So it's not truly possible to transfer all EHR functions to a mobile platform. So it's very important for development teams to focus on those things that are out-of-office functions that are regularly used by physicians. Secondly, there's no true silver bullet as it comes to devices. I think in many of our projects there are questions there that come up that say, what is the optimal mobile device for these types of solutions? And generally we find that there really is no single device that meets all needs, and that there needs to be recognition that a smartphone may work in one scenario, a tablet in another, and that they tend to be situational tools rather than one single device working in all settings. As I mentioned earlier, very important to be aware of the ergonomic challenges. So the fact that a physical keyboard is not often available on these devices, and that constraint influences the type of functions that are then put on the device. And that has to be given serious consideration as the design occurs. And then lastly, sort of an adage that we tend to use is in the UX process is there needs to be recognition that the process of going through and developing mobile solutions is not one of miniaturization, meaning that moving to a mobile EMR is not about miniaturizing the underlying application and simply displaying it on a mobile device, but instead it really does have unique device-specific, a device-specific user interface that is, in often instances, not exactly like what's being used on the desktop. So that's an important sort of consideration to be aware of. Now, despite these challenges and constraints, there are opportunities with these mobile solutions to innovate and energize the EHR solutions. As I mentioned earlier, this is coming in the form of some interesting technologies, the first being speech recognition and natural language processing. That would further enable physicians to do things and capture information in a structured way, which would be highly beneficial and help them overcome some of the challenges of doing extensive data entry. Furthermore, there are an array of technologies that are actively in place and converging in this space around unified communication and other technologies that could be put to work in conjunction with the mobile solution. So, for example, use of the camera in some instances for specialized EMRs. There's a recent example of a EMR that's used for dermatology that's made great use of the camera. And then furthermore, other innovative approaches with gesture-based computing or ways to visually display the information that's captured in the EMR in a way that makes it easier for a user to compare, for instance, real-time data or data comparing certain conditions over time. So we encourage our customers to consider these solutions because, as I mentioned earlier, there is definitely a trend to embed these into the mobile solutions to drive further adoption above and beyond what currently exists with mobile solutions. Now, apart from the UX opportunities and challenges, certainly one of the most difficult aspects of building mobile solutions relates to security. So let's talk a little bit about that. We will be conducting a workshop with a select set of customers around security itself, since it's such a detailed area, but I wanted to touch on a couple of key areas and dimensions of it in this conversation. So security in this context means maintaining privacy and integrity and the high availability of the solution and the data contained within. It further relates to restricting any unintended and unauthorized access to any and all parts of the solution by any means. So proactively finding ways to restrict access. We generally find that there are 3 levels of security. First being the device and the security associated with maintaining data and securing it on the device. Secondly, related to the transport and the network. And then thirdly, the application itself. We believe that the security for EHR, mobile EHR applications must be enterprise grade. These solutions are not limited to small applications running on smartphones. These are generally, or they generally need to be robust solutions that could pass muster in an enterprise just like other enterprise solutions. So there need to be both technologies and policies implemented that make the solutions just as robust from a security standpoint as other solutions within the enterprise. Now, these solutions also demand adherence to security laws, some which may be local to certain geographies, as a sort of a country-to-country solution or a global solution that's being developed. And similarly, there are challenges with integration where you're dealing with multiple heterogeneous systems that all have a different set of protocols and data standards, and the challenges with managing that can be formidable. So anticipate that there will need to be teams that understand and can manage and work through the challenges of security and data standards within that space. We, in the course of our work with clients, have helped clients work through a set of challenges and have developed practices that work in several areas within security. The first being techniques to secure and provision mobile devices, medical devices, and the challenge associated with employees bringing their devices to work and the need to have a BYOD strategy with that. That further requires vendors and solution developers to have solutions that really control devices, the authorized access, that they have effective guest access management, because within the healthcare world, visiting providers and other clinicians need access to these systems because they work in multiple health systems, so there's a challenge with regard to that. Lots of work associated with that. Clearly, lots of security requirements and practices related to securing patient information in the form of role-based security and building audit logs for any access to the system, just like the underlying system has. Increasingly important with mobile technologies that are in use away from the office. And then, as I mentioned earlier, the regulatory and other demands and compliance required for these solutions to be adopted by provider organizations. On a more detailed basis, we find that there is an array of tools and techniques that can be put to work to address some of the security challenges. I won't go into these in detail because I think we won't necessarily have time, but I'll touch on them. The first being device-level techniques, using MDM solutions, doing techniques at the device level to authorize and deauthorize, wipe the data, disable certain functions, manage things with regard to employee-owned devices versus enterprise applications. Secondly, there's an array of solutions and technologies and protocols that are at work or at play at the service level. So establishing SSL protocols and other techniques to ensure the safe transmission of this data to various entities that these solutions intersect with. And then lastly, in the solution level itself, establishing techniques and technologies that allow the data to be de-identified during the storage process, and other techniques to encrypt and decrypt data in the event that there is a breach of some type, protecting the data that might get in the hands of individuals that are unwarranted. So Won't get into these details to a great extent. We will have both a white paper as well as an additional seminar focusing on some of these challenges. So I'll step through and let's talk a bit about one last slide. I wanted to discuss the framework that we've established that establishes mechanisms in sort of 3 domains, the first being sort of access, things related to managing authentication, and unique IDs and how you manage that, the transmission security, and establishing secure connections, and as I mentioned, and the associated protocols to do that. And then on the storage realm, the mechanisms to manage security there. We find that it's best to use standard solutions instead of trying to reinvent them. This requires a creative approach, but also a standard approach, and one that requires extensive education of staff around all the potential challenges within this space. And as I mentioned earlier, real important to have robust access and audit mechanisms throughout the entire solution, so that in the event that there's unauthorized use, that can be monitored and tracked. So given the time, let's touch on very quickly a few case studies that we have been fortunate to sort of work through that have been the basis of some of the information that I previously have discussed. The first is an example of where we were asked to develop a mobile EHR solution on an iPad and iPhone that allowed the functions and features that I mentioned earlier, access to the information away from the office, mobile prescribing, documentation, and so forth. So we built a solution for a customer that allowed them to manage rooms and facilitate the scheduling, and it's actively now part of their product portfolio. Another interesting solution that we fortunately had the opportunity to work on as well, not directly as a mobile EMR, but a solution, as I mentioned earlier, where patient-centric data is actually being integrated into an EHR. We helped WellDoc, an mHealth company, develop a mobile application that allows a patient to manage their chronic disease, and the application works to prompt them with regard to their health status and provides real-time feedback to them and allows the physician to manage aspects of their care. It could be titrating medication or other aspects on a much more frequent basis than simply would be the case if they were, for example, taking notebooks to their physician every other month describing their care with regard to diabetes. So this solution enables much more frequent interaction with a care team and consists of 4 important dimensions, which will further expand into sort of this connected end-to-end space. One that includes a patient coach mobile application, another that has an expert system that prompts the patient with regard to aspects of their health based on the data, a decision support component that takes a look at similar patients and other populations that relate to a patient, so both on one level individualized care and on the other evidence-based, and then, as I mentioned earlier, integrated with the EMR. So some interesting case studies and ones in which we have gleaned a wealth of experience with regard to how these solutions must be developed to be adopted effectively. So given the time, I think what I'd like to do at this point is to field a couple questions. Let me take a look at my dashboard here and see what questions we have from our participants. Okay, let's see. The first question we have is from an individual that's asking, what devices do we recommend to be used for an EHR solution, smartphones or tablets? I think in this instance, I think what we generally find, and I mentioned it earlier, is that there really is no single best device or recommended device. We tend to approach it more as I mentioned earlier, a situational challenge, so that in certain circumstances, a smartphone is the most optimal device to be used. This can be away from the office or in the car or other sorts of things that are urgent. But in other instances, a tablet is more effective when a physician's doing rounds or doing other things, including things that might be interacting with the patient. The information could be presented to the patient in that sort of dialogue and improve that process. And then certainly in other instances, the standard use of desktop and laptop technologies tends to work quite well in lots of settings. So by no means is the mobile solution intended to replace that. It's just, again, intended to complement it for mobile and out-of-office circumstances. So let's see, let's move to a second question. A caller attendee asks, what are pricing strategies used by EHR vendors for these types of mobile solutions? I think what we've found in our research and with our customers is that typically the mobile solutions are available at low cost or no cost from the app stores, and then the vendor builds some pricing mechanism within their own solution as part of their license or subscription fee. So that tends to be the model that we see in place and one that's been adopted by the industry. Now, in some instances, vendors are exploring in-app purchases, which have been quite popular on the sort of consumer side, where you can select or purchase particular functions within an overall application, so the case-by-case basis, function by function. That's done extremely well in the consumer space, and so therefore it presents interesting revenue opportunities for EHR vendors that may build in an array of unique functions that would be, in many instances, not often must-haves, but would be for certain physicians of great use, and therefore they would sort of purchase them individually within the application. Within the question, the individual asks if there are instances where there's downloading one-time cost. Again, this is a circumstance where, for the most part, there is not the model where there is a one-time cost. It's generally free on the App Store, and then the cost is built into the solution itself. Let's see. Next question here. Check here. Additional question about what are the challenges of entering data in an EHR system, a mobile EHR system such as an iPad, and how do we overcome it as developers? Well, that's a broad question. Let me see if I can sort of answer it in the following way. I think there needs to be recognition that the individual users, the typical individual user physician that's about to use a mobile application, comes to the exercise with a set of personal expectations. And those expectations are based on their use of their own mobile devices. and so this could be on tablets or other e-readers or other things that they've worked with. And what you'll find, and this is very nicely framed by Sutter Health in a paper that they had presented at HIMSS. So what you find is there's a sharp contrast between the expectations and use on a personal level and the requirements for data entry and use from an enterprise mobile EHR standpoint. So for example, on a personal level, the data entry required using a mobile device is quite limited, and that's okay because typically the applications aren't that complicated, so therefore you can do a series of limited data entry and the system works, the mobile application works. Now in contrast, a mobile EHR has extensive data entry, or may have extensive data entry. So the design has to be all the more elegant to anticipate and allow easy entry and navigation. Not a trivial thing, but again, that's why the prior pages, the need to have teams that focus on this early are so important. Now, furthermore, the contrast between using a personal application and an EHR application is the length of use in which the mobile application in a personal setting would be brief use, intermittent, unlikely to be that extensive beyond checking one sort of piece of data and then moving on to other functions on the device. Now this is in contrast to, again, the mobile EHR that has extensive length of use, where, for instance, a physician might be documenting care at the point of care, and in order to do so has to use the device in an extended fashion. Raises the bar in terms of the user experience and the design required to do that. Again, personal side, simple use of applications, not that complex. You get into a mobile EHR, some of the functions are highly complex. So the bar is raised when it comes to using and developing mobile applications. It's not necessarily the same set of challenges that present themselves in consumer applications. Now, how does one sort of overcome that? I think it kind of comes in various forms. I think the demand to keep the design very clean and simple and to minimize the steps required to perform certain functions is tantamount. In certain instances, it requires, as I mentioned earlier, limiting the number of functions that one attempts to put on a mobile device. So, for instance, in certain instances, it may not be practical to put a plan of care on a smartphone. And how would one make decisions about the product with that constraint, and so on. And then lastly, as I mentioned earlier, vendors are tackling this challenge by incorporating speech recognition and natural language processing, because there is clearly recognition that the burden of doing data entry is significant, and the tools and technologies that help facilitate that would be very welcome by the physician community. So with that, let's make that the final question that we cover, given the time. I wanted to thank everyone for their participation in today's seminar. As I mentioned earlier, if you need additional details, please feel free to contact us directly. All of the information that I provided to you will be available in some form at a later point. As I mentioned, we will be conducting a workshop on security with a small number of participants to discuss mobile security in more detail. So we'll follow up and contact individual participants that have signed up for those sessions. And overall, I'd like to thank you again and wish everyone a very good day. Thank you.